Hello, I'm Callie Palmer, National Cancer Director for NHS England and Improvement. It's my great pleasure to welcome you to London Global Cancer Week 2020. The aim of London Global Cancer Week is to really focus on improving survival in low to middle income countries so that we can make a difference to people experiencing cancer and the effects of cancer around the world, and together help to improve survival. I'm delighted that the UK has played a leading role in convening London Global Cancer Week this year. There are going to be 24 virtual events running from Sunday the 15th through to Friday the 20th of November, really focusing on action and practical steps to help improve support for people around the world. Thank you for joining. We have a number of organisations contributing, including WHO and the Commonwealth. It's a fantastic collaboration of people and teams to help us all make a difference. And I really look forward to hearing the outcomes of the week, and I'm sure it'll be inspiring, moving, and a really important week for all of us. Thank you.
First of all, I would like to thank you and welcome to all of you who connect to this webinar event on the project of a reference center for diagnosis of childhood cancer in Dakar, Senegal. And this reference center will be open to the therapeutical unit and also to the sub-region of West Africa sub-region. And I would like also to thank the organizer of the London Global Cancer Week for their support and for giving us the opportunity to present this project. So we will speak in English, but also in French, because the Francophone Africa is well represented for this webinar. So thank you for all of us, and merci beaucoup. Et nous allons commencer ce webinar et cette présentation. So, why a reference center for the diagnosis of childhood cancer in Africa? And so, cancer is in middle income countries become a major cause of death. And each year, 200,000 to 300,000 new childhood cancer cases are diagnosed worldwide. So there is also an impressive gap between high-income countries where 80% of children are cured and low-middle-income countries where 80% of cases occur with only 20% of or less survival rate. So in 2018, priority of WHO Global Initiative for Childhood Cancer with target to attain 60% survival rate by 2030. But we know that the first step to access the right treatment is the accurate diagnosis. And there is a lack of capacity in cancer diagnosis in Africa. And there is difficulties to apply WHO criteria for cancer diagnosis. Why? There is a low number of pathologists and also remote places. There is a lack of equipment, reagent, and training in complementary techniques. And we really need reference centers in Africa and several reference centers in Africa in connection with treatment units in countries and sub-regions. Alliance Mondiale contre le Cancer, AMCC, which is a French branch of INCTR network, International Network for Cancer Treatment and Research, leads with the support of my Child Matters program, an initiative of the Sanofi Espoir Foundation, the setting up of such a reference center in Dakar, Senegal. So how we developed this reference center for diagnosis of childhood cancer? First of all, there is the involvement of local institutions. University Hospital with Aristide Le Dantec and Dalal Jam, the Faculty of Medicine, which at the university, the Czech Anta Diop University of Dakar. There is a local team which is very active with Professor Awa Touré and Professor Abibatou Sall, who are hematologists, Professor Sharif Dial, who is a pathologist, Dr. Fatou Bintou Diaye, who is a pediatric oncologist, and Fatimata Bintou Sall, who is actually a PhD student in France at the Institut Gustave Roussy, and which will become a clinical researcher to assume the flow samples. And there is a connection to the AMCC team with myself and also Professor Robert Coulon, who is a pathologist at the University Hospital, Trousseau, who is a pediatrician hospital, and also Dr. Elisabeth Auberger, who was implicated in a pathologist committee of the GFAOP, which is a group Franco-African of oncology pediatric. And there is also, of course, the implication of the Sanofi Espoir Foundation with the Dr. François Desbrand, who is the head of the Child Matters program for the Sanofi Espoir Foundation. So how we develop this project? The overall project goal is to develop cytological, histological, immunological, molecular, and genetic techniques to obtain the criteria defined by the WHO in order to obtain a timely and accurate diagnosis. The project will be spread over 2 phases. The first phase, for a period of 18 months, is dedicated for the improvement of sample flow of patient registration, of upgrading of pediatric anatomy and cytopathology, implementation of immunological techniques such as flow cytometry and immunohistochemistry, and extension of telepathology. We have been developed for several years in Africa, and sample banking. The second phase, which is planned between 2022 and 2024, is dedicated to the setting up of molecular and cytogenetic platforms. And of course, we want to develop research and also educational program along the project in connection with the GFAOP and also the AOEP, which is the École Africaine d'Oncologie Pédiatrique. So again, thank you for giving us the opportunity to present this ambitious project in Dakar. And the project will be presented by François Desbrand, who I presented him before, from the Child Matters program, Professor Awa Touré, how to organize as a federation of hematology laboratory to diagnose hematological malignancies, and Professor Sharif Dial, who is setting up a surgical pathology laboratory for childhood cancer at the university. So thank you for listening. And I think that Awa Touré and François Desbrand will present the program of Child Matters.
Thank you very much, Martine. Good morning, everyone. I'm very happy and honored to participate in the London Global Cancer Week. and especially to this session with the Alliance Mondiale contre le Cancer and reference centers as introduced by Professor Raphael. So my name is François Desbrandes. I'm head of the My Child Matters Childhood Cancer Philanthropic Program at the Sanofi Espoir Foundation. I'm going to present the My Child Matters program and how this initiative can contribute to improving the diagnosis of childhood cancer in sub-Saharan Africa. Sanofi Espoir is a corporate foundation which mission is to act to reduce health inequalities among populations that need it most. Among the population we support are children with cancer in low and middle income countries. This is My Child Matters. And our ambition with this program is to contribute to giving every child an equal chance of survival. My Child Matters program was launched in 2005. It has resulted in delivering expertise through an international network of committed professionals, together with the financial support to more than 80 projects in now 60 countries. In pediatric oncology, care is based on a multidisciplinary response backed by networking. And today, we are working on all key factors of improvement through a holistic approach as shown on the slide. To date, together with our partners, we are proud of significant results achieved both in terms of beneficiaries and healthcare professionals trained. Fortunately, great progress has been made in the treatment of childhood cancer in recent years. While pediatric cancer is not preventable, it can be detected early and treated effectively when patient is referred as early as possible to facilities that have specialized human and technical resources. The My Child Matter program has been engaged in supporting initiatives to improve early and accurate diagnosis for a long time. Already in 2014, the manual Early Diagnosis of Childhood Cancer was published by PAO WHO with our support. What is now a greater challenge for all stakeholders is to give every child around the world an equal chance of survival. While 90% of world children live in low and middle income countries, children with cancer in most of these countries are about 4 times more likely to die of the disease than children in high income countries. Reasons are numerous, and a poor access to early and accurate diagnosis is a major one. Those inequalities are based on a huge lack of all resources: finance, human, equipment, etc. To tackle these inequalities, WHO has launched in 2018 the Global Initiative for Childhood Cancer with the aim of reaching at least a 60% survival rate for children with cancer by 2030, as Martin said. Our foundation is strongly committed to this goal and is more and more focusing its support on low and middle income countries. We are currently supporting 34 active projects, and we are funding 7 projects to improve early and accurate diagnosis in low and middle income countries, among which 2 pathology reference centers are launched in 2020 in sub-Saharan Africa, in Dakar and Accra, and 1 specific training program in pathology at the African School of Pediatric Oncology in Rabat. For the reference centers in sub-Saharan Africa, we are working on a twinning approach between Accra and Dakar, with a roadmap phased over the next 4 to 5 years. The 2 cities will act as 2 hubs for the West Africa sub-region, covering both French and English-speaking countries, which will benefit from equipment, support, and expertise with a regional coverage, which will ensure both the permanent availability of appropriate and maintained equipment, practice, and knowledge throughout the region, and the economical rationale for efficiency and sustainability. Country ownership is key to ensure proper buy-in and long-term operationality. The two projects are locally driven. Dakar project is run as a federation of 3 major hospitals around the University of Medicine UCAD, while pathology department at the University of Ghana Medical School is responsible for the Accra project. Beside My Child Matters, both projects are strongly supported by highly committed international partners, AMCC for Dakar and St. Jude for Accra. Sustainable development cannot be achieved without a strong capacity building program for healthcare professionals. Of course, this is a long-term approach. In 2012, the French African Pediatric Oncology Group, GFAOP, established the African School of Pediatric Oncology, with 2 universities and permanent support from My Child Matters. This is a comprehensive training and certification program in pediatric oncology for French-speaking African countries. To date, impressive results have been published, with a rapid increase in the pool of qualified pediatric oncology professionals in the region. In 2020, a new set of training modules on pathology and diagnosis on an e-learning platform is being developed in connection with the Reference Center project in Dakar with My Child Matters support. This new tool is designed to reach both pathologists and physicians in order to develop a common language of fundamentals to ease, improve, and finally speed up communication during the diagnosis process. As you can see, My Child Matters program strongly supports initiative in many low and middle income countries. We are proud to support programs to develop and strengthen diagnosis capacity in Africa. And we are strongly committed to work hand in hand with our colleagues in Dakar and Accra, as well as with AMCC, St. Jude, GFAOP, and all stakeholders for the success of these initiatives. Now, I'm very pleased to introduce our next speaker, Dr. Awa Touré, Professor of Hematology at the UCAD University in Dakar, Senegal, who will explain how to organize a federation of hematology laboratories to diagnose hematological malignancies. Awa, I give you the floor.
Thank you very much, Francois. I would like to thank the organizer of London Global Cancer Week to give us the opportunity to talk about this reference center that we have started 2 months earlier. And we are going to describe our experience to setting this reference center in Dakar for the diagnosis of childhood hematologic malignancy in Africa. Why was it necessary to improve the diagnostic? Martin Raphael and Francois have told you about the Group Franco-African of Oncology Pediatric, of Pediatrics Ontology. These GFAOP work in Africa, particularly in Senegal, since 20s earlier. And since this date, the group helped clinicians to treat patients with cancer by chemotherapy. Unfortunately, 5 and 10 years later, the survival rate is less than 50%, even 20 and 10%, because of many reasons. But the biological reason is the main one. It's the delay and lack of biological diagnostic because of insufficiency of complementary technique for cytology, histology, immunophenotyping is lacked, and molecular and cytogenetics. That's why, with the support of My Child Mental Program by Sanofi Espoir Foundation, And under the coordination of AMCC, Alliance Mondiale contre le Cancer, we create a reference center for diagnosis of 5 childhood major cancer in Senegal, in connection with our local institution, Faculty of Medicine of University and Cheikh Anta Diop University and University Hospital, Aristide Le Dantec, and Dalal Jamm. To set this reference center, we have 3 sites in our faculty for anatomy and cytopathology, for immunochemistry in pediatric oncology, tissue and cell banking. In our hospital, where we have clinicians, Aristide Le Dantec Hospital, where we have clinicians, and we also have laboratory of hematology for cytology, cytochemistry, and telepathology. And at Dalal Jamm, we have another hematological laboratory with Professor Abibatu Sall, who will set the immunofighting platform. How are we going to organize all these hematologic diagnoses? At Aristide Le Dantec Hospital, we're going to do cytology and cytochemistry for leukemia, cytology for lymphomas, particularly Burkitt lymphomas, cell and plasma blood banking. At Dalal Jamm Hospital, we set a phenotyping platform to perform diagnosis of acute leukemia, and we will also store live cells in DMSO to do in later on, some patients that we did not have diagnosis earlier. All these data and all the samples will be stored in a library of samples at University Cheikh Anta Diop in our Faculty of Medicine. In details, the organization of this diagnosis will be done by a young clinical researcher, Dr. Fatoumata Bintou Sall. So when pediatrics, Dr. Nella and Dr. Fatou Bintou suspect a diagnosis of lymphomas of leukemia, they will send us a sample for diagnosis, samples, bone marrow and blood samples in 5 or 10 minutes, because we are in the same area. And 24 hours later, we are able to give them cytological results. At the same time, a blood sample is sent to Dalal Jamm hospitals, where immunophenotyping will be done by Professor Abibatu Sall. For lymph nodes and other tumors, Dr. Fatoumata Bintou Sall will organize with surgeon the biopsy in 2 and 3 days and send it to our faculty. After 10 years, Professor Jal will give back result to clinicians in Aristide Le Dantec Hospital. Next slide. And so what we have done for the project and the reference center yet, in 2 months, 15 patients have been diagnosed for acute leukemia or lymphoma. Plasma and sera have been stored at minus 80 degrees Celsius. A microscope is set in our laboratory, hematological laboratory, and you see here a picture of a resident who is doing his job. In parallel, a cytometer is set at Dalal Jamm Hospital with the agreement of Dalal Jamm administration. Next slide. And the next step will be in almost 2 or 3 years to set a new molecular biology laboratory and cytogenetic platform in our laboratory at University Cheikh Anta Diop, and especially in our Faculty of Medicine. This technique will open for pediatric solid tumor in connection with surgical pathology laboratory of pediatric tumor. This reference center to characterize hematological malignancy will be open to Senegal, country of West African region, and all the pilot units of Francophone Africa will be interact with us and Anglophone side of West Africa. This is the last slide. I thank you for your attention, and I would like to give talk to Professor Sherif Gal, who is a pathologist, the head of a laboratory of pathology in our Faculty of Medicine of University Cheikh Anta Diop of Dakar.
Thank you very much, Awa, François, and Martin. And I would like to thank the organizer giving me the chance to talk about this Center for Diagnostic of Childhood Cancer in Dakar. In this order, permit me to talk in French around that plan, la problématique soulevée qui a motivé donc la création de ce centre, l'état des lieux du laboratoire d'anatomie pathologique en général dans notre pays, les buts visés. Nous ferons également une présentation de la méthodologie qui sera proposée pour atteindre nos objectifs, et ensuite nous ferons part de quelques forces et faiblesses de ce genre de projet. Les tumeurs malignes chez l'enfant tournent autour donc des leucémies aiguës, du néphroblastome, du rétinoblastome et de lymphome et d'autres tumeurs des parties molles et autres. Et en général, on peut estimer à 250 cas annuels donc ces tumeurs. Et next slide. Qui posent en fait le problème de leur faiblesse par rapport à l'ensemble des prélèvements reçus dans notre laboratoire, le tout venant concernant surtout les prélèvements des adultes. Et ces prélèvements sont donc noyés à l'intérieur et ont moins de visibilité eu égard à le caractère urgent de ces diagnostics. Nous déplorons également une faiblesse du plateau technique, l'absence de techniques telles que l'immunohistochimie. Il y a un début de cette technique dans certaines structures, mais on se heurte toujours à des problèmes de réactifs, de rupture des réactifs et donc de pérennisation de cette technique. Ensuite, on déplore également l'insuffisance du nombre de pathologistes et également du nombre de techniciens. Et tout ceci va impacter le délai pour le diagnostic. Ce diagnostic également souffre de son caractère non optimal. Les objectifs, c'est de réduire les délais de rendu des résultats. Nous avons estimé, après discussion, que 10 jours était un objectif et nous allons essayer de l'atteindre en se basant sur la sécurisation de l'approvisionnement en réactifs, c'est en relevant le plateau technique, dotant non seulement de moyens pour la technique de routine, mais également pour des techniques complémentaires pour éviter le transfert de prélèvements à l'étranger. Ensuite, pour ce qui est de la formation, nous bénéficions du cadre universitaire et à cet effet, nous mettrons en place certainement des diplômes de formation. C'est l'objectif que nous fixons au niveau de ce centre, mettre en place des certificats, des diplômes qui permettront la formation d'autres pathologistes de la sous-région. Augmenter aussi le nombre de techniciens qui seront formés dans cette technique qui est assez particulière, notamment aussi en immunohistochimie. Et donc, ce centre va constituer donc un centre justement de formation à la fois pour les pathologistes et les techniciens. Ensuite, nous pourrons ainsi mettre en place un registre pour les tumeurs pédiatriques, donc ce qui manque jusqu'à présent, et également mettre en place une banque de tumeurs pour permettre de faire des études génétiques sur ces cancers pédiatriques. Next slide. Voilà, la méthodologie qui sera employée au cours de cette mise en phase pratique sera surtout autour de l'organisation du circuit du prélèvement. C'est là où on se heurte réellement à des difficultés. Ainsi, en amont, il faudrait, on est en train donc de mettre en place donc des staffs pluridisciplinaires qui donc vont d'abord s'occuper du partage du programme opératoire. Ensuite, lorsque les prélèvements sont effectués, ils sont reçus au niveau du laboratoire d'anatomie pathologique de l'université et donc seront acheminés de façon diligente le jour même à l'état frais. Ainsi, nous pourrons assurer donc une réception dans les meilleures conditions, pouvoir également effectuer des prélèvements à l'état frais pour la banque de tumeurs. Ensuite, au niveau du laboratoire, la technique sera mise en route immédiatement après la fixation, après la congélation également pour ces techniques de biologie moléculaire, donc la banque de tumeurs. La fixation pourra être optimisée parce qu'il y a beaucoup de difficultés qui sont liées au défaut de fixation des prélèvements, notamment lorsqu'on veut faire une technique complémentaire comme l'immunohistochimie ou la biologie moléculaire sur ces prélèvements fixés. Les étapes de la technique histopathologique seront également mieux maîtrisées dans le temps avec des techniciens qui seront dédiés à cela et ensuite il y aura aussi une plus grande célérité dans la lecture des comptes rendus ainsi que leur rédaction. Et enfin, en aval, donc, on est en train de mettre en place donc, des staffs anatomocliniques et seront complétés par la télépathologie, donc, avec la capture d'images qui seront envoyées sur la plateforme IPAD et permettront de faire donc, voilà, des staffs à distance. Donc, les forces de cet ambitieux projet, c'est d'abord le cadre universitaire. Le laboratoire d'anatomie pathologique physiquement existe et dispose de beaucoup d'espace, l'espace suffisant, sous-employé. Nous avons obtenu l'engagement de la tutelle académique de l'université à accompagner ce projet et nous disposons également d'un partenariat solide avec la Fondation Sanofi Espoir, avec l'AMCC et avec le groupe franco-africain d'oncologie pédiatrique. C'est un projet multidisciplinaire, nous avons entendu les autres parties prenantes. Et le GFAOP dispose d'une expertise avérée en matière de prise en charge des cancers de l'enfant et voilà, nous comptons sur leur appui pour que ce projet soit une réussite. Ensuite, c'est un projet aussi de formation, c'est un projet de formation de pathologistes et de techniciens et ceci va également renforcer bien sûr la qualité de ce projet. Cependant, il y aura forcément des menaces qui vont peser sur ce genre de projet, à savoir donc changer les pratiques d'abord des médecins, du personnel médical, la gestion solitaire du cancer. La multidisciplinarité sera ici donc le maître mot. Il y aura également un effort de communication à l'endroit des parents des enfants pour que justement les réticences, les oppositions, les abandons de traitement et autres, justement, reculs dans la prise en charge de ces tumeurs de l'enfant. Et tout ceci, bien sûr, dans un contexte de sous-développement qui expose donc à des risques également, mais nous comptons sur le soutien de tous pour y arriver. Donc, nous avons déjà entamé l'application de ce projet. Déjà, on compte débuter en janvier 2021 la technique d'immunohistochimie manuelle. Nous commençons donc à mettre en place cette technique. Le matériel est en train d'être mis en place. Nous disposons également, grâce à ce projet, d'un microscope muni d'une caméra avec une possibilité de connexion sur une patte pour envoyer des images et donc faire des staffs à distance. Ensuite, réfrigérateur à moins 80 degrés Celsius et en cours d'acheminement pour prendre en charge les prélèvements à l'état frais et puis la banque de tissus. Donc, à moyen terme, on le souhaite, en janvier 2022, mettre en place la technique automatique d'immunohistochimie et nous comptons combiner les deux, à la fois l'immunohistochimie manuelle et l'immunohistochimie automatique, afin d'optimiser donc notre plateau. Et pour le long terme, nous souhaitons, après 2022, avoir une autonomie de fonctionnement au niveau du laboratoire quant à ses approvisionnements. Donc, c'est un projet qui est ambitieux et qui se décline donc, dans les différentes rubriques que je viens de vous citer. Donc, je vous remercie de votre attention.
So thank you very much for the speakers, François, Awa, and Sherif. They describe you the setting up of this reference center, and we are very optimistic and very enthusiastic. And I would like to know if you have some question, but before the question, and I would like to thank you very much. First of all, Nina Jovic, I think she is among the participants because she helped a lot to set up the platform HiPaths, and she helped us for the communication and to obtain second opinion, which are very important for an accurate diagnosis. I would like also to thank Melissa Ad and of course Ian McGrath, who trust us to begin the connection among all the countries in Francophone Africa in connection with Anglophone Africa. And we have been working together for a long period. And also, I saw that Remy Milan, who is from Leica, and I would like to thank Leica and Remy, who help us to set up this lab and helping us to obtain the equipment and reagent. This is open for few questions because we are on time. So we listen to you.
Yeah.
Yes.
Do you hear me?
Yes. 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 We hear you.
I am Professor Pierre B. I am a member of AMCC and president of GFAOP. So thank you for this presentation. And we all agree that without a correct initial diagnosis of cancer in a child, there is no possibility of optimal treatment and no possibility of cure. So this initiative is of major importance for the 16 GFAOP pediatric oncology units in sub-Saharan Francophone Africa, with the opportunity for them to have an access to high-level training in Dakar and to share expertise in daily practice. So I think that it will boost a lot the possibility of good treatment in all these units. So thank you very much for this initiative.
Thank you very much. And I say it's very important, and it's quite important to develop such aspects of centers as a network. And what is very important also is a connection between Francophone and Anglophone Africa with the center in Dakar and in Accra. And I guess we could have other connection in Africa. And I think that the connection and AMCC is the French branch of INCTR, with a beautiful network in Africa to open these exchanges between reference centers. Yes?
Oui, bonjour.
Bonjour Véronique. Cathy.
Ouais, merci beaucoup. Je suis très heureuse de suivre cette conférence et ça nous fait grand plaisir. Félicitations à tous les orateurs. Ma question serait comment faire pour acheminer pour le diagnostic, parce que c'est un centre de référence de cancer de l'enfant pour l'Afrique. Comment on fait par rapport à nos prélèvements pour avoir un second avis ou pour les techniques plus poussées? Comment on va s'y prendre?
Je pense qu'il faudra avoir le soutien effectivement de ce réseau, développer les interactions et les échanges. Il est important, et je crois qu'il est important, et on a vu qu'il y avait des envois de prélèvements dans les pays étrangers. It's important for the countries in Africa that it is not necessary to send to the foreign countries. Of course, now there is no complementary technique in such countries, but we can use this connection, and we have to develop and to think about how to send sample to the reference center. This is a very important point you mentioned, Cathy, about that. Je crois que c'est très important de commencer à réfléchir comment envoyer les prélèvements dans les différents reference centers we could set up just now in Africa. But I think that there is already an experience about that. For example, I guess, I know that in the République démocratique du Congo, as you are working in Lumumbashi, but I think that you can send samples to Kinshasa where there is some techniques. So maybe you can give us your experience, I think.
Yes. Merci.
Oui, Martine, je pense que parallèlement à ce projet qui est magnifique, il faudra peut-être aussi envisager les possibilités de congélation dans différents endroits, dans différents laboratoires, pour pouvoir faire la biologie moléculaire, pouvoir faire des prélèvements congelés.
Oui, c'est très important justement de développer le banking des prélèvements, parce qu'ensuite, c'est en parallèle avec l'envoi des prélèvements. Je pense qu'il y a des envois faciles, des prélèvements pathologiques en paraffine, par exemple, ou les frottis. Mais pour les autres prélèvements, je pense qu'il y a à réfléchir et à développer comment envoyer ces prélèvements-là. Et ce qui est important, comme tu le soulignais, Laurence, c'est que déjà, localement, il y ait un banking, ce qu'il faut, à mon avis, développer dans un premier temps.
Oui,
Tout à fait.
c'est vrai.
Martine, est-ce
Oui.
que je peux poser une question?
Oui.
Oui, bonjour Martine,
Leïla.
c'est Leïla Hassisen de Rabat. Je suis en charge de l'école africaine d'oncologie pédiatrique pour le GFAOP et comme vous le savez, il y a une deuxième partie de projet ANAPAT du GFAOP qui se déroule à Rabat. C'est aussi un projet de la Fondation Sanofi Espoir. C'est surtout des cours en e-learning de pathologie. Et donc, je voulais savoir comment est-ce que vous voyez la complémentarité et la collaboration entre ces deux projets.
Alors, d'une part, sur le e-learning, nous avons été présents puisqu'il y a des cours autour de la pathologie et non seulement lors concernant des tumeurs spécifiques, rétinoblastome, néphroblastome, etc., mais aussi la surgical pathology and hematology and flow cytometry, qui sont plus généraux. Et nous allons organiser des workshops. Je pense qu'il faut une connexion entre le e-learning et quand nous pourrons le faire, because this pandémie, nous pourrons le faire, nous organiserons des workshops qui pourront être organisés soit à Dakar, soit à Accra, soit à Rabat aussi, où vous avez aussi les techniques, puisque le Maroc a déjà développé les techniques complémentaires. Donc, je pense que c'est une conjonction des deux projets.
Ok, merci beaucoup.
Merci. We are speaking in French, so I think that it's possible. Do you want we translate something for the people from Anglophone Africa? And these two projects from the e-learning, which is developed by the École africaine d'oncologie pédiatrique, and the project of a network of reference centers are in conjunction. They are in connection, and so there are a lot of changes between these two projects in the future. So if there is no other question, yes, there is another question.
Yes, you can hear me?
Yes.
Yes. Thank you for this very nice presentation. And it's very nice to have the different participants to this project speaking here on this session. It's just a question about the diagnosis of pediatric tumors. I know there are not a lot of pathologists in African countries, and so I would like to know if there are some dedicated pediatric pathology in Senegal. So, for example, a young pathologist who will be involved in these activities, because there are there is an international pediatric pathology association, which his role is also to help pathologists from all the countries in the world, and I think it would be important. It would be interesting to have an international pediatric pathology association with for example, a young pathologist from, for example, Senegal, who could be involved in this association and to get a formation, a high-level formation for the diagnosis of pediatric oncologists, and also to do research and sequencing and some up-to-date tools for the diagnosis of pediatric cancer.
Yes, it's quite important, and I think this project is very open to a connection with the International Society for Pediatric Oncology, for example, but also doing research, and it's why along this project, research project and also educational program are developed. So it's quite important to do that. And there is a question about mobile technology can help. This is from Veronique. Veronique, you can tell something about this mobile technology and the application you developed? Can I ask the question to Veronique Thévenoud, who asked a question about mobile application and mobile technology?
Right. Well, good morning to all. Good morning, Martin. Nice, very nice presentation. Can you hear me well?
Yes.
Okay. So among all the different sections and pieces of that project, I was wondering how mobile technologies can help improve in diverse sectors. For example, for the e-learning piece and the workshops, but also to disseminate the basic information among the population. As we have a mobile app like Zero Mothers Die that put the information into the hands of different health professionals and the mothers in the communities. So how those technologies that are very mobile, that can be low cost, can help in the different processes that you have been describing this morning.
Yes, this is a very interesting proposal, and I think that we can discuss together. And I think it's very important to disseminate this information about that. But I think we can use several network and mobile techniques, as you mentioned, and your mobile technique you use. So we could have discussion about that, of course.
Yes, thank you, Martin.
And
I would appreciate to have Sherif and Leila and our comments also around that. They're the best place also, as you are, to get the information around that purpose. Thank you very much.
Thank you very much.
May I ask a question?
Yes, I think there is somebody also. Yes, Claire, you can ask a question, and there is somebody else who asked a question. I did not take the question. I did not take the question. So, Claire, ask your question.
Okay. So good morning, Martin, and good morning, everybody. And thank you very much for the invitation, and really congratulations for this marvelous project. For those who don't know me, I'm Claire here. I'm a hematologist, and I'm the medical coordinator for the oncology project for Médecins Sans Frontières in Mali. We are not, our project is dedicated to women cancer, so no pediatric cancer. But we are right now with Professor Cheikh Traoré rehabilitating the pathology laboratory. And so for sure, it's a transversal tool, so useful as well for every kind of cancer. So I think we will be very happy if we can help also for link between this project and the laboratory for samples. It can be it can be a useful thing. And my question more specifically, do you think that intelligence artificial, which everybody is speaking about, will help in the following years, maybe helping in immunohistochemie or things like that? What is your opinion?
My opinion is maybe, but first of all, we have to set up the techniques, and after we can discuss about that and about some algorithms we can use to help for diagnosis. And there is some algorithm which has been developed in low, middle income countries to give a right diagnosis. I think that when the complementary techniques will be developed, we can use this, such algorithms to give a right diagnosis. Yes, that would be interesting in this picture. So, Kumba Gay, you were asking a question.
Oh, thank you. Yes, good morning, everyone.
Yes, thank you.
Yes, I'm Dr. Kumba. Thank you.
Thank you.
I would like to congratulate all the members involved in this project. This is a really big step in cancer diagnosis in Senegal. Actually, we need evidence, and this is a big way to get some evidence, actually. And I don't have specific questions, with some contributions, because you talked about research, and I think it will be useful to have another researcher working with Dr. Fall, who is the lead researcher or clinical researcher, as you mentioned before, and also considering the inter-organizational relationship highlighted during the presentation between Accra and Dakar, involving sharing resources and information. Do we have agreements or policy already set about data banking? Thank you.
Nice. Thank you. Thank you. I think research is quite important along this project, and we have to develop in parallel diagnosis and accurate diagnosis and research, and we cannot do very good research without a very good diagnosis. And to improve the diagnosis, we need research too. So it's completely connected. Okay. Thank you. Thank you. There is a question from Bienvenue Levazé. Bienvenue, you have a question?
Yes, Martin, thank you for your invitation, and I will thank also all the presenters for their speech. I will talk with Professor Chérif Dial in French. Oui. Professeur Dial, merci pour tout ce que vous avez fait, les propos. Mais je voulais bien vous rassurer que la technique manuelle, comme vous le savez, il y a des préalables, c'est-à-dire il faut voir le pré-test, tout ce qui vient avant, je sais que vous allez vous y mettre. Donc je voulais juste vous rassurer de ma collaboration, la petite expérience que j'ai acquise ici au pays, depuis 2009 que j'ai installé l'immuno-manuel à Kinshasa. Donc rassurez-vous que nous restons très ouverts pour pouvoir échanger avec votre laboratoire. Et la question de Cathy de Lubumbashi, comme vous avez répondu, Martine, donc c'est tout à fait, nous allons mettre des plateformes en place pour échanger avec ce qui va se passer à Dakar, bien entendu, localement, comme tu le sais, donc on pourra espérer que les choses pourront se développer et pouvoir travailler dans une fluidité sud-sud assez claire. Mais je reste optimiste, tu le sais, donc on va très probablement les 3-4 ans qui viennent vont aider la NAPAT à, en fait, tout ce qui est prise en charge du diagnostic dans le pays d'Afrique subsaharienne. Voilà, c'est ma petite contribution. Merci.
Merci, bienvenue. Merci, bienvenue. Et l'expérience et les expériences de chacun qui ont déjà démarré dans des endroits différents, il est important de pouvoir faire un network. The network is quite important. Yes, yes. And the exchanges of information. Yeah.
Oui, Martine, je voulais remercier le professeur Bienvenue et je connais déjà bien Cathy et je suis très enchanté de sa proposition de collaboration Sud-Sud et nous allons bien sûr nous y atteler.
C'est très bien, c'est parfait.
Ouais.
Très bien. So, It's now 10 o'clock, so 12 o'clock. So we finish this webinar, and thank you, and we think that we will succeed with this very exciting project. And again, thank you for the London
Ouvre-nous, sinon on va nous tuer. Ok.
Merci beaucoup.
Merci beaucoup.
Merci,
Merci, bye bye.
Bye.
Merci, bye.
Bye.
Bye.